Hey, what's up, you guys? This is Ayal with Bebop Talks Cancer. Today I'm here with Alix Miller talking about her diagnosis, her story, and just talking about cancer. So, hi,
Yeah,
Alex, how are you?
I'm good. How are you?
I'm good. I'm good. So
Excited to have this conversation. Yeah.
now that we've done the formal introduction of all podcasts, and sometimes I do this, I feel like I should talk like this in my NPR voice. But so if you would tell us, who you are and what city you're from,
Mhm.
if you want to throw in one fun fact, and just a little bit about your cancer story, and then we'll kind of
Okay.
get into it from there.
Yeah, totally. So I live in Akron, Ohio. All of my treatment was up in Cleveland at the clinic, Cleveland Clinic. And I was diagnosed with AML leukemia about 2 years ago. Thanksgiving is when things kind of started, when I started feeling really bad and started going to the hospital. So right around this time of year, which is an interesting time of year for me, especially when, you like look back in your memories on your phone and stuff like that. I see the pictures of myself that I took and taken when I was like not feeling well, but didn't know what was going on yet. And I was like, oh,
Mm,
that poor baby. Little does she know. Little does she know. But yeah, I was then diagnosed with AML leukemia, which is acute myeloid leukemia, bone marrow. So throughout my entire body, my essentially just what happened is my blood turned on me and started to attack my body. Is the easiest way to explain it. So then through that, I did, I think, 6 rounds of chemo. Um, I was able to find a bone marrow donor through bethematch.com. A little side note, if nobody's signed up and they have the ability to, always go sign up for Be the Match. You can change somebody's life.
it won't
Um,
be in the corner here, but we'll put it in the thing. I don't know
it was
if
like,
we do that yet.
yeah, definitely
Yeah,
giving that one a shout out because that was,
yeah.
huge, huge for a lot of people. Um, but I got this is my fun fact. My all my animals, they're just going to make an appearance. So,
Awesome.
um, but I was diagnosed. It took I want to say maybe 6 to 8 months once I was on the program to find a donor.
Mm,
Um, and then in March of it would have been 2022 then. In March of 2022 was when I was able to get the bone marrow and then they did the transplant. Um, which
mm,
is just like a bag of fluid it goes right through my port. It was very, very simple. Which is surprising considering that taking like the bone marrow biopsy samples is a drill into your um, back of your hip bone, and then they like pull the biopsy through it. Yeah, which
mm.
is awful and terrible. So then the getting the bone marrow was exceptionally like painless and easy. It feels um it felt like something so small for what a huge difference it was making in my life to just
Right.
be hanging in a bag on my tower. It still blows my mind to this day that just one little black like bag of platelets changed everything.
Mm.
But
Science.
I'm
No,
very
yeah.
I know science, it's crazy. I'm very grateful. I'm very
Yeah.
grateful.
So, to talk about the timeline, and you were diagnosed around this time, 2021.
Yes, 2021.
2021, and then like what were the symptoms that how did you know? Like
So
what happened, I
I
guess?
I started like having a loss of appetite, and I also started sleeping like a lot. I was very, very tired and like fatigued, like inside of my bones, fatigued, like tired from deeper than I've ever been tired before. Um, and I was bruising a lot, but I bruise very easily anyway. I
Mm,
was anemic from the jump, so I bruised very easily. So I didn't really think about that. And then I ended up missing a couple days of work, which I just don't do. I'm not like that. I bartend, so there's not really much missing work that's going to happen
mhm,
when, your finances are day to day like that. And so missed a couple shifts of work. Still went in. There's like a day that I remember I was like crying over rolling silverware because my manager was like, just go roll silverware because I was like feeling so not well. So
mm,
then I went to I went and got a COVID test done. I think I got like 2 or 3 COVID tests done, and
Hmm.
all of them are coming back negative. I went and got a flu shot. It didn't do anything. Like, I was doing, anything that I could do. And then, at some point I had been taking like some ibuprofen and stuff, to sort of just deal with how I'd been feeling.
Hmm.
And, I I went to Thanksgiving with my parents, passed out in my car after I had driven myself home because I was just feeling so terrible. And then got upstairs, laid down on my couch, TMI, threw up a whole bunch of black blood. And that was like, okay, that's just totally not normal. That goes way
Right.
beyond being like a
Yeah.
flu or COVID, or even if it is, that you got to go to the hospital at that point.
Hmm.
So I called my dad. He came, picked me up, took me to the hospital. They ran some blood tests. That's where they were like, these blood tests are not normal. So I was living down in Massillon, Ohio at the time, which is closer to Canton, which is where the Football Hall of Fame is. And I went to a hospital called Altman down there.
Okay.
Um, and so they put me on, like, they thought that I had TB. They thought I had tuberculosis at first.
Really?
So yeah, so they put me
Wow.
on like a quarantine ward, and like everybody, like my family, my dad was having to be in like a hazmat suit around me and like
Oh.
everything, which is, just I don't, traumatizing, triggering, whatever the correct word
Yeah.
is,
Yeah.
for when everything is already happening. And then
Hmm.
like the one person, like your mom or your dad, who could give you some sort of comfort has to come in like a full body like hazmat. It's just so uncomfortable. You feel like Stitch, you feel like a
Yeah.
little, like an
Yeah.
alien, like
Like, am
nobody
I a
can touch
Marvel
you.
character? You're like,
Yeah, right. So um about a week of them kind of trying to treat me for TB, and then they
hmm.
finally came in, and my doctor was like, "You, this is AML leukemia, and we put in a transfer, and we're sending you up to Cleveland Clinic today." And so that a couple hours later, I got into the ambulance, and they transferred me up to the clinic. I think later that week, I got my first port put in, and
Crazy.
I did my first round. The leukemia floor at the time in Cleveland Clinic was either full or something along those lines. So I did my very first round of chemo actually, in another quarantine room on a COVID floor, which is
Mm.
crazy that they even had me on a COVID floor, but it was still, very, it's Cleveland Clinic. They were phenomenal.
Hmm.
But then once I did that first round and then I was able to move upstairs, I think I did another round of chemo inpatient, and then COVID got bad again, so they did one round outpatient. So I came home every night after my chemo, and then the other 3 were all also inpatient. And then I was able to get my bone marrow transplant, and I'm very lucky because I still have had no problems with it, turning on me or anything
Yeah.
happening. Knock on wood, that I don't have to have that experience.
So, I mean,
And
I know, but just for those who don't know, right? I'm kidding. I have no idea about like your bone marrow. Like after you get the transplant, you're just okay, or like,
Okay, so like after you get the transplant, you get put onto like 100-day quarantine. So like I literally was not allowed to leave my house for 100 days. It was
hmm.
very difficult. I was allowed to like go on walks, and I had a caregiver, and he was with me at all times, but he was not allowed to leave the house. We couldn't like go to Walmart, or we were
Hmm.
doing all delivery, whatever. So you do the quarantine. Um, there is a chance that throughout that, so right before they do the transplant, they do the hardest chemo that's available. I can't remember what it's called. It wouldn't help anyway. It's a big word that I would not be able to pronounce properly.
I
But
should know it, but continue. Yeah.
yeah, so they do the big bang out chemo that knocks out your whole immune system so that you're at your very lowest, so that your
Mm-hmm.
body is willing to accept the new marrow. Because one of the concerns is that immediately your body would realize that this is not ours, and
Mm-hmm.
would just get rid of it or attack it or do what essentially my body's was doing anyway.
Mm-hmm.
So they give you the transplant, it goes in, you kind of stay in the hospital, they monitor for a while. And then I was able to go home because I was doing okay. I definitely pushed it because I was done in the hospital. So I pushed it and I looked at my doctor, I think one day, and I looked at him and I said, I'm either you're going to discharge me or I'm going to walk out of here. I'm not really sure what the answer is, but I need to go home. Like, because separate conversation, but the balance of your mental health,
Mm,
and your physical health is equally as important and something that's very difficult. Um, that's a hard line to walk of your mental health and being concerned about your physical health, and when the knowledge of your physical health is almost too overwhelming that you can't think straight or do any, and so I was ready. I needed to go home for a couple days to reset. I should not have done that
mm,
because my counts ended up dropping like really badly, and I had to go to the ER. While I was at the ER, they accidentally clipped my port line too tight and broke it. Um so then I ended up having to get another port put back in, and I did flatline very quickly and then came back and everything was fine. But that's on me because I did not want to be in the hospital anymore. So I
yeah.
did end up going back and doing, being watched and monitored and whatever. So listen to your doctors. Don't be an asshole like I was. But
You
tis a learning experience, I suppose.
did you say you flatlined?
Very quickly and very briefly, yes.
Okay.
Because
Why?
of all the trauma that was going on with my port was so much that my
Yeah.
body was like not really willing to deal with it. And I just had my most heavy chemo done.
Right.
I was like, I can send you a picture. I had my jaundice was insane. I didn't realize how yellow a human being could get. And when
Mm,
I look back on those pictures now, especially because when you're like actively in a state and this is how you're used to seeing yourself. So I was sick and I had been used to seeing myself as a sick person. I didn't
mm-hmm.
realize how bad it was. And like it was quite it's quite crazy, honestly, to see
To
some
look
of
back
those
at it.
to look back on some of those things. Yeah.
Yeah.
Um
Well,
but
like,
yeah, then the bone marrow.
yeah.
Oh, go ahead.
Oh, no, 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 you.
The bone marrow, the bone marrow, it's a crazy concept because like I said, it's just like a bag, and it looks
Mm.
like blood, but it's inside of your bones. So it's like I had a blood cancer, but also the inside of my bones were attacking me and changing my white blood cells, where I think then attacking my red blood cells, or vice versa. I might be confusing those.
And did you
Um,
try a greens powder? I'm just kidding.
a
Um,
greens.
no, I'm
I
just
wish a
like
greens powder. The oh, I don't want to name drop.
no, no, it's like and what crystals did you specifically use in that moment where you flatlined?
Yeah, and so then I ground the crystals up and they were able to put it right into my tower,
That's
right
how it
into my
works.
saline
Yeah.
drip, and it was
And
phenomenal.
I do love, like, I've got crystals at home, I have a
Oh
greens
yeah.
powder too, it's like, but it's
Oh
so
yeah.
funny. And so to like segue a little bit into one thing I think that's like so specific to Bebop and what you said is you you felt like you needed to go home, and there's something it's like very near and dear to Bebop. I mean, it's at the core of it, is that hospitals lack so much humanity, I think is a good word
Yes.
for it. And like,
Yes.
again, like
It's just so sterile.
a big thing for Bebop is that just because you have a cancer experience doesn't mean you can't have a human experience. Well, what is the human experience? And it is anything. It could be
Yeah.
like, I feel like if, there's, that's why murals are so big for us, for example. I mean, just some color. And it's like, because you used a good word, sterile. And it's like, okay, but like the walls have paint on them. It doesn't have to be white, you know? It doesn't have to feel like we are like lost in um, this medical world. I mean, and that's sometimes how it
Yeah.
feels. So I guess the
Yeah.
question I'd ask is like, you use this term, I needed to go home, and then it kind of, and if this is like the wrong way to say it, I'm sorry, like it kind of cost you an experience, right? Of all these
Yeah.
things. Do you feel like, had the hospital felt more homely, you might not have felt that way, or, because look,
Yes.
anxiety gets me here, and then after that, who knows who I am,
Yeah. No. Yeah, no, I do. I think that I honestly like, and I did things because I was doing long stays. I think one of my longest stays was like 8 weeks or something like that. So I started doing things. I have oh, you can't see it. It's right here.
Mm.
I have this little guy,
Hmm.
which is just like a sun lamp, $5, Five Below, nothing crazy.
I
I
love Five
had I
Below.
have an orange one, I had a pink one, and I would take him
Mm.
into the hospital because I could change the lights in there, and that was kind
Hmm.
of nice. And then like,
I love that.
another small thing that I did, we took a Fire Stick. We took a Fire Stick so that we could plug into the TV. I'm not watching that terrible cable that they have. It's
Yeah,
awful. I don't want to watch
yeah.
HGTV for I was in there for a year. I don't want to watch HGTV for a year. Like occasionally when you go visit your grandparents, that's a good time, It's a little bit of nostalgia, but not like that. Oh.
Shout
And
out to
so like
HGTV. We love you, but
I-
you
we
know,
we know her, we love her. We
yeah.
really do. We really do. I'm not talking any trash at all. I'm big
But
on home decor, but
yeah,
you
no,
know,
I get it.
um enough is enough at a certain point. And so there were like I had a tiny little white Christmas tree because I went in around Thanksgiving, so we
Hmm.
did my Christmas there. But like there are things that would be so nice, like you're saying, like murals or like the ability to like personalize to any degree, to have like maybe not stark white hospital sheets. I mean, I love a good
Hmm.
hospital blanket, but I'm a big pink girl. Hello, like I've got a Barbie room, that is my theme. So like I would have died to have some pink blankets and things like that. And you bring in your own blankets, and I did, and you can do so much to that degree, but also at the same time it's like it's just like it's hard to be stuck in a room because like
Hmm.
during my quarantine for my after I had my transplant, I'm not even allowed to leave the room. I'm not allowed to interact with the other patients. I'm not allowed to
Right.
do anything. So during that time, like it's hard to get motivated to get up and change from one pajamas to another pajamas when you first
Hmm.
off don't feel like getting up, and then and second off, like if anytime your port's sore, the second time they put in my port, um the first one was really nice, it hung straight down. The second one kind of hung to the side, so then
Mm.
it was doing a lot of pulling right here, so it was just terribly uncomfortable at all times. And like your skin is just your skin's so sensitive, everything's sensitive, everything is difficult. You don't like you I felt like Oscar the Grouch, and for valid reasons. But
Hmm.
like, like just like, oh my God, like everything is overstimulating, everything's too much. It would be so nice to be in a room with a bigger than a 4x4 window that's not
Hmm.
looking at another building. Like most of the windows for my rooms were awful. I will say that. I will say. Cleveland
The
Clinic, please do better on
it's
the views.
the,
Um
yes, the
but
view.
like
I think that's a tough one, but yeah, like I think
the view, like I'm just like
or
there's
like
nothing to look
shooting
at,
in
like
rainforest sounds every once in a while, or like
yeah,
like this.
anything. And
Let's. Oh,
cuz
sorry.
like and the things that they're doing to like help you in there are so much, right? Like the air, they have the special air that they're pumping through the leukemia unit and like all of the things. And but also at the same time I'm like you being sick for me personally,
Hmm.
it was a hard experience because I did feel like I lost a lot of my humanity, because you
Hmm.
almost start to feel like a science project. And then we got to come in and check it every 2 hours and make sure this and make sure that. And somebody's poking you here and checking this there and
Hmm.
coming in and out and in and out and in and out. And like, I think that sometimes these doctors and nurses, and especially nurses aides, like this is their daily life. So they just become maybe slightly desensitized to it. It's not that they don't care, but it's just that you see it all the
Hmm.
time. You have to survive that. I can't
And
imagine
it's
what it's like
it's
to have
not
these
the
patients.
it's not like the best correlative, but like I serve at a restaurant part time, and and we've talked about that, and like your bartender and like every person who eats there thinks they're special. Everybody ordering a drink, I know, thinks they're special, and you're just like,
Right.
let's go, like so like
Yeah.
and
Like
nurses, I mean, you know, I get that. And then too with like the prodding and every 2 hours, it's like you don't get any sleep. Like
No sleep.
you
No
don't.
sleep. I still struggle to sleep. I mean, I
Hmm.
honestly like I have my bedroom and all and I love my room very much and I also did a lot of redecorating after I was sick
Mm.
because I felt like I had sat in my room and rotted for a
Hmm.
year. So I like completely redecorated, completely I actually have two bedrooms in this apartment cuz I needed two toilets while I was doing the chemo whatever, so we got a two bedroom apartment. Um the back bedroom was actually the room that I did all my treatment in. So I've actually moved into the smaller bedroom in this apartment and all of my roommates, I've been like, you can have the bigger room. Like it's got a
Mm.
bathroom attached to it. Just take it. Cause like, I don't want to be back there.
Yeah.
It's just, I tried to reclaim that room. I tried to reclaim that space. It's just stayed uncomfortable for me. So I moved into here. I completely redecorated my room. I made it very girly and pink and just like, I'm doing, in a way, you know, I'm doing all these things that maybe I wouldn't have before because like
Hmm.
we really only have this one life. And like it's a YOLO, it's a haha, you know, everything's
It's a
just a funny
YOLO.
joke or a saying or whatever. But like
Yeah.
there's so much validity in that when
Hmm.
like when you've really come face to face with your humanity. I think there's a lot of validity in these things that are like, well, you only get to live once or you do only have these experiences one time.
Mm.
Like now that I've been allowed to be out in public and things like that and I'm healthy and I can work again, I go dancing with my friends all the time.
Hmm.
I'm singing out loud when I'm at work. I'm giggling, I'm joking. I do all of the things that I want to do and I don't care if they're silly and they're childish. Like I'm going sledding. As soon as the snow really sticks, I'm going sledding
And
because
that's such
like
a it's such a good like message to other people and to patients and to people who, I mean, you could be 5, 10 years, 20 years, so on and so forth, away from your chemo or your cancer experience, and still feel trauma and still feel and and then there's people who are just getting their diagnosis, and it's
yeah,
like, you know, I think that there's such obviously like terminal illness it'll always be the one that's like, but there's definitely something so positive about what you're saying, in the sense that like there's life after life, or like, like for me, I could tell
yeah,
you a big thing is I'm even so, like, I'm not a big life after life, like I'm one continuous life, like this just sort of happened, it happens, I'm still happening, thankfully, other
yeah,
stuff will happen,
right,
like,
yeah.
um
And I think that's like one of my biggest things too, right? So like I don't know how your cancer experience was exactly with how they deal with your remission and stuff like that, because with mine I'm not like technically ever really in a remission because of my
mm,
type of cancer vibe. But I am in remission. I just say I am because look at all this hair, you know?
look at all of it.
And so um I think about it all the time. If it could come as quickly as it did,
Mm,
my doctor said that with the type of cancer that I had, I went from it not existing to being stage 4 and potentially terminal within 2 weeks. That's how quickly I got sick. So when I started not feeling well at the beginning of that, that was actually the beginning of it. It hadn't been ruminating at all. That was it. And then boom, that 2 weeks where I passed out in my car and threw up and had that terrible experience and then went straight to that was me getting sick. That was exactly what it was, which is a crazy concept to think that it can happen that quickly. And if it were to happen again, the
mm,
chances of me defeating it are not very high. Just because of the amount of chemo that's already been in my body, the fact that my immune system is not currently a real thing. I'm still working on getting that back. I haven't had any vaccines or anything like your little kid vaccines that because when I have a new blood type now, I have a new everything, so I'm
oh
essentially like
wow,
a newborn baby. Yeah,
whoa,
so y- yeah, I forgot to mention that part.
that's
So
gnarly,
when they gave
yeah,
yeah, yeah, so I have a new blood type. Don't ask me what it is, I can't remember. I have to refer to my paperwork every single time somebody asks
cool,
me.
cool.
But
That's a new tattoo, right? Like,
no,
like,
yeah, right. Yeah, no kidding. No brain, no thing. But I so like I have to go back through and get new vaccines and all that stuff. I just can't do that yet. I have to be a certain amount of time outside of the cancer before I can go and get any vaccines. I am coming up on that, thankfully. It will
mm,
make me feel a lot more confident about being out in the world.
mm-hmm.
Um Although I imagine that this time right now has done nothing but help my immune system get stronger. So,
Mm-hmm.
um, but oh, I lost my train of thought.
So it's okay. I mean, I feel like
Yeah,
you've
story of my life.
no story of my life, story of our lives.
It's the chemo fog. Oh my gosh, one of my best friends was pregnant and she had pregnancy brain and I had bad chemo fog because I was a lot closer to my
Mm-hmm.
initial release and it was just the two of us walking around the house not knowing what was going on.
So, what's so funny is I told my parents, I was like, chemo brain is like a real thing. And they're like, what are you talking about? And I'm like, look, in the middle of talking to you, I don't remember why I'm talking to you or what you
Gone.
said.
It's
Or
gone.
like, it's
Yeah.
really like when I'm talking, I'm like 75% through whatever I'm saying. And then all of a sudden, I just forget what I'm supposed to say at the end of the sentence. You're
Yeah, and I'm
talking
like,
as
and I
soon
was
as you
going
start talking.
somewhere.
Yeah.
I'm like, and I was on the train and we were almost there and somehow I ended up at the wrong station.
Mm-hmm.
Um, basically just like YOLO, because if I get sick again, there's a good chance that I'm not going to make it out. It's a good chance that people are going to come and see me in a grave or wear me in a
Mm.
necklace. And that's okay. And I've accepted that because I am DNR. I did make that choice. All of those things, you know.
Yeah.
So, um, I want to go dancing with my friends.
Mm.
I want to make sure that the people that I know that I love, I want to make sure that they know how much I love them until I
Mm.
don't have that opportunity to do that anymore. And so now like and I also want to give that to myself as well. Like I want to like we as a society, we grow into adults, right? And then we have to kind of become serious or do whatever it is that you're supposed to do when you're an adult. And I'm almost 30 and I've been divorced or I've been married and I'm divorced and I've been sick now and I've had a lot of life experience and I've done a lot of different things and I think that sometimes, you get to a point where you're like, so what am I supposed to be doing? And I don't think there's an answer for that. I'm supposed to be having a good time. I'm supposed to be grateful that I get to experience this day and that I'm waking up all the time. I'm supposed to be cuddling with my 800 animals and working at a bar making my silly little potions because it's what I love doing.
Mm-hmm.
And like if that's what serves me right now, who cares if it serves nobody else because it serves me and it's fulfilling to me. And if this is my little life, then this is my little life that I love very much. And it doesn't have to be anything bigger than that. And that can be enough and that's okay. I think that idea that like societal idea of like what is enough or what are we supposed to be doing or how something should look or how somebody should act or the standard of perfect, and how to be a perfect person in remission or all of these things like
Mm-hmm.
that's so impossible to do. It's so hard to get at. And so
And that's
um
that. Like that's a great segue to like what you and I were talking about before. Is like,
yeah.
and for those who weren't in our conversation earlier, we've talked about like just this perfect like I got cancer and you and I have similar vices that we've talked about and like after cancer, during cancer, after in remission for me, like all of a sudden I'm supposed to be on greens powder and an influx of vitamin D and it's weird because it's like okay,
Oh my
yeah,
god, the
like
vitamin D. Oh, the potassium in the vitamin D. I swear to god that they're all and do you know, I'm sorry, 2 second segue. They're
oh,
like you're lacking vitamin D. I live in Ohio.
mm-hmm,
Of course I'm lacking vitamin D. Are you kidding me?
mm-hmm.
Like that was the funniest thing in the whole world. Anyway, continue.
No, it's like I mean that's kind of the idea is that it's just so crazy to me like I and then it's not even other people like me to myself become it's like I already have like depression and all these things like everybody does but now there's this new layer where it's like
Oh, yeah.
I'm not supposed to be depressed. I'm a survivor. I'm not supposed, like I'm not supposed to be depressed. I'm an inspiration. And
Yeah, man.
it's like, oh,
You
like, and it's not like I can't take the pressure. No, but it's really just like there's this, I don't. I got sober before cancer, so like but there is this I just know, like, oh, to have a drink, oh, to smoke. Like, I was a pack a day
Mm-hmm.
smoker, and I was
Mm-hmm.
27 when I got cancer, so it's like being this, what do they call it, AYA, like adult, adolescent, youth, whatever it is, like
Yeah. It's,
I feel, yeah, like I
I
feel
feel
like
like,
we're supposed to be perfect or something.
especially getting sick as a young person,
Mm-hmm.
specifically getting sick as a young person is so much, right? Because we haven't we haven't hit our 30s yet, or we're just barely hitting our 30s, and then you think about that, right? And you think about, holy shit, there's so much more life that I have to live.
Mm-hmm.
And then that the pressure of living this long perfect life, that to not fuck up during this whole length of the rest of what you have to do. Because, I mean, God forbid I live until I'm 100. I really hope I don't do that. But God forbid I live until I'm 100. I've got like 70 more years to do this.
Mm-hmm.
That's insane. That's a lot of pressure to put on myself, for myself, to me, from nobody else, to me, from me. It's a lot
Mm-hmm.
of pressure to have. And then you add in the outside pressure, and it's like almost to the point like where you're saying, well, shit, I was already depressed, I'm already stressed out, I'm already anxious, you're adding something else on top of it, and it's giving this, I have to be perfect, or I have to do, I can't mess up, because if I do mess up, it's on me, and even worse, it's compromising my health,
Mm-hmm.
and then I have nobody to blame. And
And
for
I
me,
think,
like, I had nobody
yeah,
to blame at the beginning,
and it's so interesting what
because
you said.
depending on what type of cancer.
Right. Oh yeah,
But
sorry.
yeah, and depending on what type of cancer you have, like, like you could it
I
could
know
come out of nowhere.
perfectly
Mine came
healthy.
out of nowhere.
I know the
I,
healthiest person was my parents' chiropractor, and he got cancer and passed away within 6 months. And this was like
I'm telling you, it's,
tennis every day. He like would see me as a kid and
yeah,
be like, "Are you eating right?" And I'd be like, "God, I hate you. I'm like just gaining weight, eating
yeah.
terrible." I blame Tyson's chicken a lot. I just like to say it, but
Oh,
I also
I
shout out
just
to
love a good
Tyson's chicken.
chicken
I just
nugget.
love Tyson's chicken.
You know what? I
It's
just
like
love a good chicken
the
nugget.
best and worst commercial would be my commercial for Tyson's chicken. I'd be like, "Well, look, okay." So
Yeah.
yeah, I mean, I think that an important thing to what you said too, as a disclaimer to anybody who's made it 33 minutes into us talking, is like that we I always think about the people who would make it this far into my life. 33 minutes into this, good for you. But
Oh yeah.
like
Yeah, good for you.
um
Thanks for sticking around.
like what you said is like, it's me to me, like uh just because you say, like, I'm almost 30, like you could be 40 and feeling 20. You have that
Yeah.
20,
Oh
you
yeah,
could be.
cuz that's like the joke. Yeah, that's like the joke, like I'm the like, funniest 29-year-old, 16-year-old girl I've ever met. Like, that's
Mm,
like, cuz that's so true. I'm like, I still feel like, oh, but now I have knowledge. Like, if give me my 16-year-old body back with my 29-year-old brain. Let me do some things. Like, let me cook, cuz I could make some changes happen. But actually I don't regret anything that I've done. I wouldn't change a thing. But um like I think one of the biggest things that I constantly remind myself is to give myself grace.
mm.
The grace that you would give to the person you love the most in your life, to do that for yourself as well. Um, you know, cuz it's to each their own, this journey of life, but of cancer as well. And so how you deal with it and how you handle it is on you, and to do your best. Please don't cold turkey your medicines or do anything crazy that could be
it's so
compromising.
it's so
But
crazy.
also sometimes, like, listening to your body is equally as important as listening to your doctors. Like, listen to yourself and listen to them. Like,
Mhm.
because you can't just let like, I'm not saying that these doctors will, but you can't just let these doctors bully you into certain things, because they're medicine is a practice. medicine is a practice. I like to just emphasize that, right? So like nothing is for certain. And that's why when you go in there, they try X, Y, and Z. That's like I said earlier, they thought at first I had tuberculosis. Well, they're running through their checklist of what it could be.
Mm-hmm.
I'm allergic to compazine. It gave me which is a pain medication.
Mm-hmm.
Right, that they use for anybody who doesn't know what compazine is. But and they were it's one of the like entry level pain medications as well. So it's one that they kind of try for everybody. It's like Zoloft is to
Mm-hmm.
mental health vibe. And so I had an allergic reaction to it, but I lost my motor function. So I couldn't talk. I wasn't able to move my hands and my feet. It's a very weird allergic reaction. I've never had anything like that in my life. And they're thinking that because I'm losing my motor function, so like potentially I'm having like heart attack, something greater. So they're bringing in like EKG and doing like all this
Mm-hmm.
stuff. And like, and I don't know how to express, cause I don't even know that that it's the compazine. I also don't know what's going on. And I can't talk. My tongue has stopped working. I totally, anyway, one of these doctors comes running in and he's like, let's try and give her a shot of Benadryl. Well, it worked because liquid Benadryl is, just the bee's knees. But I immediately motor functions were back, and then within 15 minutes, I was passed out because it's liquid Benadryl. God bless her soul for putting me to sleep that
Mm-hmm.
quickly. But like it's one of those things where it's a practice. It's trial and error to a certain degree. Obviously there are things that are known now, but
It's
there is trial and
experimental
error to
till
a
it
certain degree.
works, you
It's
know?
just it's experimental until it works. So
Yeah.
if you don't like something that's going on in part of your treatment or to a certain degree, or whatever, speak up for yourself, because
Yeah.
you're the only person who could change that. You're also the only person who is immediately experiencing what you're experiencing. The people around us, the doctors, our caregivers, all of these people, they love us, so of course they're around us. They want to see us do better, but they don't understand the immediate experience. You're the only one who knows how you exactly feel. And that can be very lonely, but it can also
Mm.
be very empowering depending on how you want to see that. And you got to be able to advocate for yourself. I think that's very important,
You know, I'm Southern, so my mom always said, squeaky wheel gets fixed first. And,
Yeah.
it's so
Yeah.
true. Like, if, it just, that's
Closed mouths don't get fed.
exactly. I mean, that's the
Yep.
reality of, like, and I think there is that line where, like, so much of, like, I have it written down in one of my, like, crazy notebooks that's like, if it's helping the doctor, it's helping everyone, or helping the nurse, it's helping everyone. It's like one of the tenets of Bebop, which is like, so if we make your room more fun, you're a better patient. You are
Yeah.
listening to the, like, I remember, like, a nurse came into the room I was in, she said a whole bunch of stuff. She, like, left, and I'm like, what did she, like, you're reading me
Mm-hmm.
numbers, like, oh, my blood count is this, like, cancer, like, what do I still have it,
Yeah.
like,
Yeah.
what are you
No, literally.
doing,
I'm like, okay. Are you, so, and so,
mm-hmm.
like exactly what you're saying. Because like, it's hard, like, and they do that. They come in, they read off their little chart, and they've got their posse of like, students that are learning, and
Right.
they're all kind of like nodding their heads like the goddamn sardines from SpongeBob. And they're all
Mm.
like, yep, mm-hmm, yep, mm-hmm. And then they walk out. And I'm like, and I don't know what we just talked about. Because not only am I on morphine and I have a fentanyl patch on, I just woke up, I've been awake for 30 seconds. You're saying these words that are taller than, I am, if you lay it out.
Mm.
I have no idea what's going on or what we're talking about. I will say that's where my caregiver, I mean, he did an exceptional job of communicating with my family, of communicating with the doctors, writing things down, figuring out, going to Google, Googling things, figuring out the easiest way to explain things to me so that I had a good understanding of what was going on.
Mm-hmm.
Um, shout out to our caregivers, because those people truly and honestly, just deserve the world to a certain degree,
Yeah.
because that is a difficult space to be in, and to watch somebody that you care about be sick like that is, I can only imagine.
Mm-hmm.
And like I said, we had the pain medication and the naps and all of the things putting us to sleep for a lot of, at least for me, for a lot of my treatment. I did a lot of sleeping. I did a lot
Mm-hmm.
of sleeping in that hospital. So, I didn't, I did experience it, but I didn't have to watch it. And I can say that that's got to be a separate kind of difficult to watch somebody you care be sick like that and not be able to change it. So um
I
grateful for the
think
people that were around me while I was sick as well.
mm, I think that like the the last question I have, and you and I have talked pretty extensively outside of this too, that like mental health is, like we have our physical health, but and I think this is a big part of Bebop. It's like we have our physical health, but when you get this diagnosis, whatever it is, I mean, if you're a parent of a kid who's got cancer, or like for me, like I was really shook on the fact that like my brother's brother got cancer, my sister's brother got cancer, my dad's son, my mom's son, my cousin's cousin, like you know, I think that like the physical side of cancer, it's like we basically like take me, like
Yeah.
whatever at this point, what the doctor like. I mean, I guess for some patients, again, disclaimer, it can be different, but for
Right.
me, it was like, what do I have to do? But it sounds
Yeah.
like to me, you and I, this is a big part of Bebop, is like how that environment, how the experience of cancer, which encompasses the hospital, the home. For us at Bebop, like a big thing I'm trying to get into is the clothing that we wear. I
Yeah. I
want to
mean,
feel
that's what
proud, and
originally
yeah.
that was like the original thing that made me reach out to you and say
Hmm.
something, because like I mentioned earlier, quickly, how my second port hung to the side,
Hmm.
and like the I'm sure you've been through it, shopping for shirts that have buttons that go deep enough that you don't feel fully exposed, but it's not a pain to put it on. And
Hmm.
like we're cold all the time, so it would be nice to not have to take my whole arm out of the sleeve every time that they want to do any type of blood work, or and if it does hang out, like where's the shirt sitting? So is it pushing onto anything? I mean, my scarring is like mostly scarring actually from the like patch that covers over the entry point of the port,
Hmm.
just because like my skin just did terrible with it. And so like things like that, where it's just like or like with the zippers and I mean the ice cream cone, or the not ice cream, but the popsicle, like that is so cancer universal. Like that is so like simple but so genius, right? And it's funny but respectful, and there's so much behind that. And like the thought process of the shirt, like the shirts and the pants and all of that, like it's so you're taking out some of the difficult things that gets missed
Hmm.
in the treatment. Like, yes, they have the tower that you can carry back and forth, and it doesn't have to be plugged into the wall the whole time anymore. That's very nice that you gave me 4 hours of battery time. But to be honest, I'm going to be sitting on my butt in this bed anyway. So can I just
Hmm.
have like some clothes that are actually comfortable while my skin is falling off of my body?
Right.
Like, I know I mentioned it earlier, like flannel sheets would have been phenomenal in the hospital. They would have been soft and fuzzy flannel sheets. I don't want these stiff cotton, and paint is still can be fun and still be clean. Like we can, there are ways to do this where we're not leaving out our mental health, and we're not putting people in a 4x4 wall. And
Right.
I mean, my animals are service animals. From when I was sick, my doctors were able to get some paperwork signed so that they were all recognized as emotional support animals,
Mm.
because that was a huge thing for me. Being able to go home and see my animals was a huge thing for me, and I understand that not everybody has that ability when they're sick, just depending
Right.
on what your doctors are allowing around you for your immune system, and because we're all immunocompromised at this point,
Hmm.
so
Well, it's, yeah, I mean,
so
that's the thing is, I always say, like, it doesn't make sense. Like, children's hospitals, awesome. Like, phenomenal.
yeah,
Like, Elephant Room
yeah.
3 versus adult hospitals where it's just like, y'all could have painted this different. Like, I'm okay with it. Or, like, I don't, if they're doing it there, like, I don't know. I don't understand. And it,
Where the loss is, it's because you know what it is it's because like for children, we still want to uphold this, like you don't want to break that wall for the kid yet,
mhm,
of like Santa isn't real, or life can be not beautiful kind of a thing. So
mhm,
and I think as an adult, there's just this understanding
You've
that,
been
oh,
broken.
you
Yeah.
know, you know, you know,
Mhm.
you know what I
So
mean? And so
stupid.
nobody's pretending anymore. So there's
Mhm.
no level of doing that. But I don't think that that's pretending. I think that your environment it makes a huge impact on your mental health.
Mm.
It's the same concept as your friends, the people you surround yourself. You're going to be most like the people that you surround yourself with. So those people make an impact on your mental health and on your life. So do the walls that you contain yourself in. I'm
It's like having a
All of
cool
my friends are
nurse.
going to watch this and they're going to laugh. All my friends are going to watch this and they're going to laugh because all I do is talk about home decor all day long, because
Okay.
your home is so important. What you put around yourself is so important. They should be pieces of you on your walls. We can't be living in these homes with no artwork. Like, you can't do that. We need hospital rooms that have artwork. I was
So
bringing
do
in my
we
own art
hate
and had it like up
HGTV?
around.
So we
I
hate
do want to be on
HGTV?
we we love HGTV, but we've seen all of it.
We've
So
seen all of it. Yeah. I mean, it would be really cool if there was an HGTV show that was hospital room makeover. Now
hospital room
that
makeover.
we're gonna HGTV. If you've made
I've
it,
got a pitch.
yeah, to 46 minutes of this conversation, we figured it out. All right, like
I've got a pitch for
we
you.
got to. Hospital room makeover would be really cool. That's
That
like,
would be so cool. And you know what? Like, and I understand that there are certain things that you need. You need the plugs in the walls. You
yeah,
need the
yeah,
bed.
yeah.
All X, Y, and Z. Sure, fine. Yes, I agree.
Mm,
But also, like, there are some things that we could do that would be so nice. I mean, paint the walls, put a mirror in there.
hmm
I mean, to
I
a
don't know
certain
about a
degree, I
mirror.
stopped looking at myself. I
Yeah.
was gonna say I stopped looking at myself when I was sick, but I implore people to continue to look at themselves when you're sick, and to be comfortable with that version of you, be familiar with all those versions of you, because that's still you. I think,
Mm,
like, I felt so disconnected from myself at a certain point, because you stop looking like you when your skin is a different color and you have no
mm,
body hair and your nails are falling off and all of these things are going on, and you stop feeling like you. So I think it's important to stay acquainted with that person in that way.
I love
Um,
that.
because she is still in me, like
Hmm
I'm still carrying her with me every day.
hmm
So
Yeah,
I think that's,
sometimes, I mean,
it's equally as important.
it's probably for another type of podcast, but I definitely know what it's like to wake up and be like, I feel so sorry for that child inside of me, because I'm like, you're still cool, man. Like, you can get out there. You could. I want to, like. It's the classic thing of like, I have a morning routine. I do it like once or twice a week. So is
Yeah.
it a routine, or, um, like, uh, but yeah, I mean, I think that we've like really rounded it out to where it's just this understanding that like we lose control of the big things. We lose
Hmm.
control of the big things. So then it's like innate to try and make changes to what the little things are, or what used to be or are considered the little things. But those then become the big things. I mean, I know that sounds so silly, but like, that's why at Bebop we've done the hospital socks, and we're doing like, and again, like Bebop is
They
such.
do become the big things. Like, when your world gets shattered and it gets brought down to that smallerness, that tininess of a level, right? And now you only exist at home and only exist in the hospital, and you kind of isolate yourself to that degree. All those little things, they're like they become the things that you care about, the things that you think about all day long. I mean, I watched so much food content while I couldn't eat, which I've now learned is a thing that people do, which I think is very funny, because I
Mhm,
mean, every food show on Netflix, I've watched it like 4 times on every platform I could possibly. I'm all Claire Chaffetz on YouTube. I love her. I could watch that woman cook all day long. Okay, but
mhm,
like, those things that become so small, that seem so small, things that you take for granted every day. Showering every day. I think routine is a hard thing to get back after you've been sick. It
mhm,
is a hard thing to get back your normal regular routines of brushing your teeth every morning when your mouth is sloughed off, so you didn't do it for 2 months, because how could you? Like,
mhm,
or showering on a regular basis when you couldn't stand to be in even slightly hot water for, I don't know, however long, and everybody's treatment is different, but those were my own experiences. So then when I was able to get back into the bathroom and comfortably put on face moisturizer that I have loved my whole life, but for some reason it burned while I was sick, it's hard to get back in that routine. Or like my hair is growing back out. Oh my God, I don't know what to do with it. First off, it's curly and it wasn't before, but like
Mm,
now it's growing back out, and I just don't know what to do with my hair because I haven't had hair for so long, and I
yeah.
feel like I'm like, oh, and so it's like those types of things. I agree.
Mm. Yeah, I used to. It's so funny. Um I gained a lot of weight during cancer, and people like
Really?
they're like, "How?" And I'm like, "Well, I mean, I smoked a lot of weed, and I would go. My routine during cancer was chemo, and then this place that I've been going to since I was a little kid, Moe's Pizza, and I would get an entire pizza and wings, and then over the course of like the next 5 days, just eat cold pizza, wings, and throw it up, and then like go back to the fridge and just like have a piece of pizza and play video games. And like my mom would like, and I moved back. I was in my parents' house, but I was gonna move out, and then I stayed, and then I like moved into my childhood bedroom, and
Mm.
I just put a TV at the end of the bed and played Red Dead Redemption 2 on PlayStation forever. And I literally just like got out of cancer 40 pounds heavier than I was before. And, you know, when my hair grew back, it wasn't thick anymore. It's a lot thinner than it is. And, you're supposed to say to yourself, I'm alive. But you're like a year out, 2 years out, and I'm kind of just still working off the weight. I'm still finding my haircut. I'm still, like,
Yeah,
and there's
man.
this part of me that's like, oh, like, I should be better. Like my expectation for myself is so much higher than what I'm achieving. And then that's the whole like the
Yes.
routine joke about twice a week. Like, like I should be better. I should be better. I should be better. And it's like then there's that point where I like stop shitting all over myself. And I'm just
Oh
like,
my God.
okay, I'm fine. I'm good enough. And
Yeah.
it's such a relief. And then, because we're going to wrap up in a second, but like, then community, right? Like to kind of like,
Yes.
I, like you reaching out to me, like, it's when you reached out to me, and I don't know if I can't remember if I told you this in my response that like I had just gotten off like a 10-hour shift at the restaurant of just completely like I'm like there's food all over me, like I'm in all black clothing and there's like stains everywhere, and
Oh,
I'm
I know
just
the
like
vibe.
my
Yeah.
brain is dead, my cheeks are tired because I've just been
Smiling,
oh yeah, you're
talking.
like
Yeah.
you're like
Yeah, of
putting
course.
down
No
food and
problem.
people are
I'll
just
be right
like,
back.
yeah,
Yeah.
like, oh, that wasn't enough ice, or like, oh, you wanted more lemon from the lemon I brought you. No, just but point it. That's another
Yeah,
podcast.
no, literally.
Like, that the like the motivation and the knowledge that there's other people, like it's a club you don't want to be in, but you're in, and then you're happy that there's other people there.
Yeah. And like I know we touched on this earlier, but I just think like especially as a young person, it feels specifically isolating. Everybody on my floor was
Hmm.
older. Um and so like, it it's not only is cancer isolating, but then cancer as a young person is even more so isolating. And you do a lot of why meing yourself.
Hmm.
Um and like woe is me type shit, and then you got to pull yourself out of it eventually. There's always room to have a little bit of a pity party. I'm a cancer, zodiac cancer. Yeah, there's a joke there, trust me, I know.
Yeah, yeah,
um but I believe that crying is good for you, and it's okay to throw yourself a little pity party, even if it's every day, as long as it's 5 to 10 minutes and you get up and you have the rest of your day. And
yeah,
so
yeah,
um when you get that diagnosis, don't feel bad. You're allowed to grieve your own life to a certain degree. You're allowed to be upset about it, and then push through and do better.
When you say don't
And
feel bad, do you mean don't blame yourself? Is that really what you
yeah,
mean? Like, don't
like
when you say don't feel bad, because
yeah,
I mean,
like
like,
to not
you gonna feel some bad, but the don't
yeah, no.
blame
Yeah,
yourself.
like don't blame yourself, and however like you deal with your with your journey of being sick, or the person maybe the person that you care about is sick. However you decide to go through that journey, um there's nothing wrong with that, because there's no right or wrong in this. And that,
Mm,
and to not, to don't feel bad, don't guilt yourself into feeling like you aren't doing cancer the right way. There's no right way to do
mm.
treatment. There's no right way to deal with remission. I think I mean there
I
but
like to say that
within boundaries.
there's like a wrong way to do stuff. Like, I know the wrong way to do things. Sometimes I don't know the right way, but I know the
Yeah.
wrong way,
Yeah.
there's I can find some wrong ways to do things. Um,
Easily. Easily.
so yeah, I mean, um, think we've touched on so much great stuff, and it's kind of the point of this podcast, is just to talk. Is like, we've talked about it before, like, there's so many of these that really come off in the NPR voice, and a story of triumph and love, and it's like, honestly, it's so
Sure.
exhausting, and it's like,
Just
ugh.
like that, and also the story of me throwing up every hour on the hour.
Yeah, yeah, or just like looking at myself and being like, ugh, like, doesn't really come out well in my NPR interview. And shout out to NPR. I keep shitting
No,
on
but
that
that's so
company.
valid. And you know what? I did want to say that really quick, is that just touching on how much your body changes while you're sick.
Mm,
Um, oh my gosh, that's such a difficult thing. Like, I have a lot more loose skin. I did the opposite of what you did. I lost a lot of weight rapidly. So
mm,
I ended up with a lot of loose skin, a lot of stretch marks in my stomach and stuff like that. And I've tried desperately for the last 2 years to put weight back on, and I've gained 10 pounds. Doesn't matter. Have not put any weight on.
mm,
So, um, I like, but there's that, it's hard to look at yourself, especially naked in the mirror,
mm,
especially as a younger person who has now had a serious body trauma experience, and to be okay with who you are now, and to
mhm.
know that there's nothing wrong with that. But that there's so much validity in having to be comfortable with yourself and moving through that, and to know that there's no timeline on that, and
Yeah,
it's not a linear experience.
it's
So like all of
empowering.
those,
I mean, when
it's
you hit that,
empowering.
yeah, like, to just be like, F everything, F everybody. And, like, it's funny that we do a lot of, like, F cancer stuff, but, like, I've told people, like, oh, I'm trying to get away from it because I want to find new ways to express it, and to, like, express that
Right.
level, to hit that level of anger and aggression, but also, like, a love and compassion that maybe only a cancer patient can know, only a hospitalized person can know.
Yeah.
But I
Mhm.
don't know anybody who ain't got trauma, and I think that's like an underlying thing, is that, like I
Yeah.
said, the cancer experience doesn't have to negate the human experience. And, your story is going to hit so many different places for so many different people. And I think that's what's important. And that's why I find these podcasts to be so cool, because we're not going to do any, like, flashy editing or anything like that. um we will be on social media at Bebop Cancer Foundation. um and I'm excited for the future of Bebop. I'm excited for your future, and
Thank you.
we will talk soon. So thank you so much for doing
Yeah.
it.
Thank you for the invite. And so I'm excited to see what you have in store for the future. I know you're going to do a lot of great things with this, so very proud of you. Preemptively proud of
Thank
you.
you. Thank you. Well, you stay on here. I'm going to hit the pause button. So,
Okay.
to anyone who made it an hour into our conversation, thank you so much for listening. Please follow us. And I'm working on how to get this on Spotify, but also it'll be on our YouTube channel and social media. So, see you later.
Yes.